Play dominoes? Well, listen here. Here's a brand new show that just dropped. While the presenters play dominoes, a special guest will be discussing all topics that matter to you. Everything from judicial, legal, health, wealth. Nothing is off topic. The name, you ask me? Domino Effect. Domino Effect. Come listen. It's time well spent.
Hello everybody, how's everybody doing? Again, this is Sweet Will, with Domino Effect, and our crew over here, that's Vodes and Padre, and of course our guest Patricia. Today we're going to be talking about patient advocacy. So I'm going to pass it over to my man Vodes.
Yes, we remember we talked about insurance before with know the type of insurance. Now today, one of the topic that we are going to talk about, and that's the reason why we have Nurse Pat with us today. And it's a subject that it's very important for the viewer that's watching us today to know about it. So before I ask Nurse Pat about the subject, so I'm gonna present Nurse Pat to talk about herself and what's brought her here today.
Hey, everybody. How's everybody doing?
Good, we good.
We're good.
So, I am Patricia. I have over 2 decades of,
Okay.
I have 2 decades of nursing experience. I've worked in inpatient and outpatient settings. I'm not here tonight representing any organization, but I currently work as a case manager for an insurance company. And I also teach nursing students for a college. And currently, patient advocacy is one of the things that I'm passionate about. And the reason being is that in our community, also the Black and brown community, there are a lot of issues. The issues that come up are when you have a patient in the hospital, you have a family member, you don't exactly know what to do for them and how to ask for help.
Okay.
And you have to be able to know what to do and who to go to. So all of you have health insurance, especially if you live in Massachusetts, right?
Yes.
Or else they're going to tax you. You're not going to see that tax refund.
Yep.
Yes.
Yep.
So your health insurance, do you know that your health insurance includes a case manager?
Yes.
What is a case manager?
Okay. A case manager is basically a licensed nurse like myself who plays different roles. There are different types of case managers.
Okay.
There's an insurance case manager. There's a hospital case manager. Is it my turn?
Yes.
There's a hospital case manager. There are nursing home case managers. There's home health, like a VNA case manager. So there are different types of case managers. The insurance case manager, there's two kinds. There's one that does utilization reviews, which is myself. I'm a utilization review case manager. What I do is that I make sure that the care that you're receiving in the hospital, the care that the hospital is asking for you, the care that the home care agency is asking for you, the care that the skilled nursing agency is asking for you is, first of all, economically sound. That means it's cheap enough and that it fits the diagnosis that you have. So that's the review that I'm doing.
Okay.
So that it's medically necessary for you and that it fits the bill, that the bill is not too high. And if the bill is too high, there are ways around it. The case manager, though, at the hospital is like an orchestra director.
Okay.
Your job.
She looks at, is my turn?
Your turn.
Or
Yes, your turn.
Your turn.
Oh.
You pass.
I passed too. So she's basically looking at you and saying, okay, when you get out of the hospital, you need to go to a skilled nursing facility. You need to go to a rehab, or you need home care, or you need a wheelchair, or you need a walker. And she's looking to see, where can I get those resources? So she's an orchestra and she's directing traffic.
Yeah.
But
She's-
okay, now that you said that, so but what if I don't know all these things? How do I get to this? I mean, how do I get to this situation where I can get the case manager to advocate for me, or the way you make it sound like?
Does
That's
the
in-
hospital just automatically give you one? I think.
Yes, every single, when there's something called discharge planning.
Okay.
The minute discharge planning happens the minute you're admitted to the hospital.
Okay.
Discharge planning starts from the minute you get admitted. And the reason why it's done that way, it's my turn.
Yes, your turn.
What's that over there? Yeah, it passed. So, and the reason why it's done that way is so that you don't get to stay in the hospital longer than you need to be there.
Okay.
So you're assigned a case manager right then and there, because the case manager needs to make sure that the hospital is going to be paid.
Okay.
Let's say you go to the hospital with cellulitis. Cellulitis is a skin infection. And my insurance company says you don't need to be admitted with cellulitis. So you're in a status called observation. The case manager is the one doing the review and sending it to the insurance company to say, hey, this person was just admitted with cellulitis. So the insurance company can say, no, you need to put them in observation because I'm not paying you for an inpatient status.
Okay.
So the case manager is working on it. Let's say if your status changes, where your cellulitis, you also have pneumonia with it. You can be admitted with pneumonia. So the case manager is communicating with your insurance company saying they now have pneumonia. So it's a little bit worse than what we first thought.
Okay.
So the case manager is directing traffic. You get a case manager the minute you get admitted to the hospital. And on the insurance side, if you're somebody that's a diabetic, my turn?
Yes.
If you're somebody that's a diabetic, because that's a chronic illness, your insurance company automatically assigns you a
Yes.
case manager. There are certain medications, if you're taking them, you automatically get assigned a case manager.
Okay, but I'm gonna ask that question again.
You
How
call.
do I? Okay, how
You
do I
pick up
know
the phone.
that I have a case manager?
They call your house.
Okay.
They call your house. They send you a letter.
Okay.
If you do not respond to that call, if you do not respond to that letter, they try you 3 times.
Okay. Three
Three
times
ti-
that's right?
3, yep. 3
So-
strikes and you're out.
Strike you.
So
I passed.
So the case management is here for only if you're gonna admit to the hospital, or
No.
is it
They're,
outpatient
they're
as well?
there. They're there if you have a chronic illness, if you admit to the hospital, or if you pick up the phone and call and you ask for one. That's all you have to do.
Okay, okay.
And that's why I say patient advocacy is a big thing. Because if you know you have a chronic illness, if you know there's a problem, and you pick up the phone and you call and you say, hi, my name is so-and-so, and I'd like to speak to a case manager because I have an issue and I need some help.
Okay.
They will assign someone to you and that person will help you. The primary care doctor's office that you belong to also has case managers.
Okay.
They also have case managers who can also help you, because there are patients who have issues where these patients need something such as Meals on Wheels.
Okay.
And Meals on Wheels apply to people with chronic illness, people who have no family and cannot cook for themselves, people who are shut in, and those case managers can help get those services. There are also elderly who live alone and cannot take care of themselves. Case manager can help them get home care.
Okay. I have a question for you.
Go ahead.
The case management you're talking about, who paid them? Is it me or the insurance?
The insurance pays for that.
The insurance pay for it. What if I don't have that coverage on my insurance? Or is it all the
insurances have case managers.
All right.
Okay.
So you say that the insurance has a case manager, the hospital has a case manager. So that means if I just played that.
Okay.
So that means so I would need to know that I need whatever situation I'm in, I need to reach out to the office in order for me to get my case manager to work on my behalf.
Yes.
Okay, so now that has nothing to do with the doctors. Just straight up the case manager that's gonna help me finding anything that I need.
Yes.
Okay.
But at this point, you have two case managers because if when you go to the hospital, they give you one, and your insurance give you one.
Yes.
So which one do you call?
Oh.
Do you call the one at the hospital that you have, or do you call
You
the
can
insurance?
call both.
Oh,
You can call
So who
both.
just played that?
I didn't.
Okay, so your turn.
So
It's your
okay,
turn.
you call both. I understand you call both, but what about the
Oh, actually,
insurance?
no.
The insurance is
Who played that?
I played that, so your
Okay, so
turn.
that's your turn.
No,
The insurance is here to protect themselves. So
no, but they're also there to protect you. So I'm going to give you a simple
okay.
case. This is a case where I used to work. I had a young patient.
your turn.
I passed.
Injury?
Okay,
Really?
good.
That's what you got to say? That I didn't come to play? So I had a young patient.
All right,
See?
what you won?
Yes.
I had a young patient, and the young patient was in need of certain services. I saw that the hospital was not providing the services. I read through the chart, and I was able to decipher, okay, these are the services that are needed. I was able to call the hospital case manager and say, they need these services. This is how you can go about it. These are some of the resources I know about.
Okay.
I currently know of a patient right now. The patient needs a place to go. And the case manager that was working on this patient's case didn't know of certain resources. Because I said to this case manager, do you know there's something called, elder foster homes? And she's like, what's that? I said, oh, you don't know about that? Let me educate you about that. And I gave her the information. She's like, oh my gosh, that's an awesome resource. I said, okay, do you know the Nigerian community in Worcester has like a huge community and this is what's going on? She's like, oh, I didn't know about that. So sometimes if you call the insurance case manager and you say, oh, I'm in the hospital and these are the issues that I'm having, the insurance case manager can call the hospital case manager so they can work hand in hand to help you.
Okay.
But okay.
Nurse Pat, hold on.
Yes.
Go ahead,
Nurse
go ahead.
Pat, and we thank you for great information that you are providing for our viewers today. But I have a question. What about the immigrant people that doesn't speak English, that do not know about patient advocacy? So how can they find this research that you are talking about?
What they can do is when they're in the hospital, they can be sure to do the following. These are some of the things that you can definitely do. When you're in the hospital, be truthful. A lot of times I see, well, in my past work, because I used to work in another capacity, we had a patient from Haiti who didn't speak English. He was really ill, and he just basically told these people that he really
Yeah.
that he needed services. He didn't tell them that he was living with friends, so he had no place to go.
Wow.
And this man was going to die. So once we found out, because I overheard him speaking, and I'm like, okay, I speak Haitian Creole, and I can hear him speaking and saying that he doesn't have a place to go. So I'm like, okay. I went back and I told everybody he doesn't have a place to go, and this man is really sick.
Okay.
So we were able to speak and find out, okay, where can we put him? What can we do? What happened? Whose turn is
He
it?
was trying to play because that's his.
Oh,
Yeah, go ahead, go ahead.
it's like okay, where can we put him? We're able to find a hospice home for him. We're able to find resources for him. We were able to find
Really?
what
Your turn.
what happened?
Yeah,
Oh,
your
I
turn.
passed again.
Oh, you passed again?
Ah, y'all are killing me.
Your turn.
What?
Oh, yeah.
Yeah,
There you
of
go.
course.
He wins again.
Yeah, he wins
So,
again.
okay.
So yeah, okay. In advocating for yourself and for your family members, this is what I can tell you. Okay.
Yes.
You have to know your medical history. Let's say you're advocating for your family members. You have to know their medical history. You have to know their medications.
Yep.
You have to know their doctors.
Yes.
Because let's say your parent goes to 5 different doctors and you don't know their names. You need to know their names, because if one is at Lawrence General and one is at Mass General and those 2 systems do not speak to each other,
That's a problem.
that's a problem.
Okay.
Because you have to know so that all the medical records match.
And I think that's one of the reasons why a lot of people are afraid to maybe get this information, because we're talking about HIPAA. Not a lot of people want to disclose certain information.
But these HIPAA, here's where HIPAA differs. Okay? HIPAA, it's the Health Insurance Portability Accountability Act.
Okay.
When it comes to your health care, it's not like you're going to tell JoJo from the corner or little Marie from the corner. This is the healthcare provider that's providing care for you.
So that means you have no
So
choice
you
but to
have
tell
to
them
disclose what's
Exactly.
going on
Yes.
so that they can provide you the best care.
Yeah. Okay.
That's what you need to do. So if that's the family member that you have as your healthcare proxy,
Yes.
they need to know what medications you're taking. If you're a daily cannabis user, you need to let them know. Because if they don't know that you're a daily cannabis user and they take you to the hospital and the hospital does tests, and then they go and they speak to you about, oh, do you know that your mother has cannabis in their system, and you're standing there like,
way.
my mom would never take cannabis, and then they're looking at you like, okay, he doesn't know anything about his mother. Or okay, we had a patient. Everybody knew the patient, and the patient was HIV positive. Nobody wanted to translate for the patient. They took me to translate for the patient. So I don't know the patient.
Okay.
I go, hi. I go to translate. The patient starts speaking in Creole.
Wow.
Full-blown Creole. She's like, where did I get this HIV from? And I'm sitting here and I'm like, okay.
But with all of this you just said, so that means I have at my insurance what I call my chart. So that means everybody should be able to have access to their record through that.
They should.
Yeah.
But imagine if somebody doesn't speak English.
Okay.
My
They
chart is in English.
Yeah, it's
Yeah.
in English, and also
And
not
if you don't
everybody-
have access to a smartphone and you don't know how to use it,
Okay.
how are you going to access my chart?
You said something earlier on. I just wanna, if you can
Go ahead.
clarify for us.
Sure.
Can a family member be a patient advocacy?
Yes.
Advocate?
Absolutely.
Okay.
I'm my son's advocate,
Okay.
where he has given me access to his my chart, where I speak for him, but I speak for him with his permission.
Permission, yes.
I don't just go off cuff and just, start saying, oh, he needs this and he needs that.
But do they
So-
make you sign authorization?
Yes,
from the
he
patient?
he signed an authorization giving me permission. So going back to how to advocate for them, you have to be present.
Yes.
You can't just be on the phone and you're calling and you're saying, oh, do this for my mother, do this for my father, and you never show up. These people never see you. Because one of the things that a lot of healthcare providers complain about, they complain about the fact that there's all these family members always butting in and saying, we want this, we want that, but they never show up. And don't lie to these people. Don't say, oh, she doesn't have any place to stay, but she lives with you and you claim her on your taxes.
Your tax, yes.
Don't. I'm serious.
Yeah.
And represent things honestly. Don't
Yes.
say, oh, I have 3 houses and blah, 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 when
You live on the street.
yeah.
Yeah.
You're a streetwalker. You're a night walker, and
your
your parents got
It's your turn. I think Sweet Will had a question. That's why he's.
what's your question,
he-
Sweet Will?
He's trying to play. So, if you pass, then that's your turn now.
That's your turn, yeah.
So and then ask for help. Ask for help, because we had this was my worst case. This poor lady,
turn.
her sister picked her up from the hospital. Took her from the hospital and brought her home. Then the sister turned around and brought her back and said, nope, I can't take care of her.
Wow.
Don't be.
Yeah.
But who was the proxy? Was it the sister?
The sister was the healthcare proxy. The sister brought her back and said,
Wow.
I can't take care of her. And here's the lady crying.
But in a case like that,
Yeah.
who should be advocating for this person now?
The case manager.
The case manager become the proxy pretty
Well,
much.
she didn't become the proxy.
But she's
She's
advocating.
advocating for the patient, trying to find a place to, because the patient's now homeless. So she's advocating, and I'm like, okay, what does the patient need? And I'm like, oh, do you know Friendly House in Worcester? It's a women's shelter. She can go there until we can find her housing. I'm like, what's going on with her? Case manager at the hospital is looking at me like, aren't you here with students? I'm like, yeah, but I can help you with discharge planning. Let's look at it. Let's look and see where we can send her.
So with that saying that you can have as many patient advocate that can advocate on your behalf?
Absolutely. Absolutely.
Yeah.
Because I've seen people from the church go and advocate for.
But do you need a authorization from
No.
them? Okay.
No, because you're not looking at their chart.
Oh.
You're just speaking up for them. You're not asking about their health.
Okay.
You're just speaking up for them.
Okay, so you're basically being their representative.
Yes.
Yes.
You're just representing their interest.
Okay.
You're just
So-
representing their interest.
So if I'm understanding this from all this, so anybody can advocate for anybody,
Yes.
for any patient, right? And the only thing that really matters is the proxy part where where they have to be given authorization for that.
Yes. Well, okay. Here's where you're muddling the lines.
What?
When you're somebody's healthcare proxy, I designate you as my healthcare proxy.
Okay.
When I designate you as my
So
healthcare
I already
proxy,
know that you
I'm
already given me
saying-
authorization.
I'm saying if in the event where I can't speak for myself,
yeah.
I'm giving you the right to
Okay.
say what happens with me. That's what a healthcare proxy is.
Oh.
There's also a living will that I can write and say, this is what I want to happen to my life. There's also something called a power of attorney.
Oh, that's my turn. Sorry.
Yeah, there's also something called a power
Power
of
will.
attorney where I say, okay, in the event that I'm not available, you can buy, sell things on my behalf. So there's many different things.
So that's
Being a patient advocate, a nurse, this is what we were trained to do. And there are different types of nurses. I know you said that. There's different types of nurses. I know the minute I spoke about the fact that I'm a nurse, and I've worked in many different mediums. As an LPN, I worked in LTAC, and I worked as part of an LTAC is a long-term acute care facility, and I worked as part of an LVAD team. So it's, nurses don't just work in nursing homes.
okay.
So
Hospital.
all hospitals, you can, it all depends on who your network is.
Okay.
What kind of friends you have and how you sell yourself and how you project who you are and how you market yourself, because you can market yourself and you can work anywhere and everywhere based on your education and your experience.
Okay.
Because I've worked in many different settings.
Why doesn't the health bill have like one system where they can go to and look at the chart? Because there's like 4 different ones to make it easy on the doctors themselves and the nurses. That way, it kills times and it saves lives. Where they have to, I have like 3 different apps on my phone with different. If I go to CVS, there's a chart for that.
It's all a money-making business, is what I can tell you.
This capitalism at its best.
It's because, let's say Emerson uses Meditech. Let's say
Mass General.
Mass General uses Epic, and UMass uses Epic as well, but it's not the same.
I mean, it's not the same version, so they don't speak to each other.
But if you transferred with what I know about Epic, if you transferred to a different hospital that has Epic, they should be able to pull your chart with your
They can.
authorization.
They can.
Yeah.
They can.
I have
Now you just said that. There's something that just happened recently. There's a hospital or some facility that just closed, right? So
Whose turn is it?
I just played, so that's his turn. So would case manager be advocating for some of these
Patients to transfer them to the right place? Absolutely.
Okay, because
It's
I
your
just
turn.
heard that this place just closed.
Hospital
I have
closed
a
down.
with that back. I have a question too. I know we're not talking about this, but if a hospital closed, where do the people's medical record goes? If
The
they want it,
the medical records need to. There's a law.
yeah.
So the medical records need to be maintained for 10 years.
Okay. So if let's say the hospital, they can close the hospital. If I wanna transfer to a hospital, I should be able to have access to my medical record. Okay. And also, last question for you regarding the proxy. The proxy, and I know Mac talk about that too. Let's say if I have a proxy that I pass.
Same.
Let's say if I have someone have a
Who knows he
proxy.
closed it? I wish.
Yeah.
So
He knows.
the question is, do if the person's still alive and I am the proxy, do I still need authorization, or can I go behind the person back to go find the information or medical record or anything? Especially dealing with your grandma and dealing with
That's a sticky situation. You're the person's healthcare proxy to make decisions for themselves if they cannot, and if the healthcare proxy is invoked. The healthcare proxy is invoked when the person is deemed to not have capacity, and then they invoke the healthcare proxy.
Okay.
You show up somewhere and you say, I'm the healthcare proxy and I'd like some information.
You're not gonna get
you're
that.
not gonna get, because you have to have the authorization.
Yeah.
Okay.
Thank you.
So and the person have to be in a capacity where they can't. So basically, they just ready to go.
No, it's not that they're ready to go. If somebody has Alzheimer's and you're the healthcare proxy.
Hey, I got to ask
You're
questions.
ready to go.
on.
What?
Did you win?
You trying to bump me off?
I'm just making
Like you
sure.
can invoke your healthcare
I'm just
proxy.
making sure. You know what I mean?
Like,
So
what?
if the person is ready to go, so you just go ahead and do it.
So don't
You do the
forget, one of the things that you need to do when you're advocating for your family members in need, you need to know their medical history. Tell them to tell you the whole truth, and nothing but the truth.
Yes.
You have to know their medications, know who their providers are, and be truthful and forthcoming. Ask questions. A lot of times, doctors come to you and they start speaking to you in medical terminology.
Yes.
That's why I try to make sure I never tell doctors that I'm in the medical field. I don't. I tell them, break it down to me. Speak to me and
Thank you for letting me know.
so and represent yourself honestly. Don't say that you're a nurse when you're a CNA.
You pass?
I passed.
Don't say you're a nurse when you're a CNA. You know?
Yes.
So guys, it was fun coming
So
here.
before we finish, and I know Sweet Will's going to do the closing, what can you tell our viewers? What can you tell us, like, with this information? What is the last thing? Can you just
The last thing, be vigilant.
Okay.
I received a bill from the hospital. I called my insurance company. My insurance company is like, they haven't even billed us yet. Why are they sending you a bill? So think about it. You could have received a bill and you would have paid it. And then your insurance would have paid it. The hospital would have probably sent you back the money, right? Or would they
But
have?
they would send it to the insurance company versus us.
Exactly.
Because the
So
insurance
think about
company
it.
paid the second time versus us.
Exactly. So be vigilant.
So we need to
Pay
be vigilant.
attention. Pay attention.
Sounds like a scheme.
A
to me,
scheme
but I
out
won't go
there.
there.
Pay
Without
attention.
saying
I don't
anything.
deal with insurance.
Pay attention.
With
What
that
you
being
mean?
said, Patricia, I want to say thank you. Thank you for all this information. And
You're welcome.
It was
I
great
want to say thank you
information.
to our viewers once more. Please don't forget, on the bottom, press like, subscribe. Thank you so much. See you next time.
All right.
Yes.
Peace out.
Peace out.